When do common phonological processes resolve? Imagine a young child trying to say their favorite word, but it comes out a little different each time. That's because they are using phonological processes to simplify speech. These are patterns children naturally use as they learn to talk. They help make words easier to say and understand. Most of these patterns disappear as children grow and their speech skills improve. But sometimes, they stick around longer than they should. When that happens, it might mean there is a phonological disorder or delay. Let's look at some common phonological processes and when they usually resolve in children who are developing normally. One of the earliest is final consonant deletion. That's when a child leaves off the last consonant in a word. For example, saying "ka" instead of "cat." This process usually goes away by around 3 years old. Another common pattern is fronting, where sounds made at the back of the mouth like K or G are replaced with sounds at the front like T or D. For example, saying "te" instead of "ki." Children typically stop fronting by 3.5 years old. Gliding is when a child replaces L or R sounds with W or Y, for example, yike instead of like. This pattern often resolves by 6 years of age. Vowelization happens when a child replaces a L or R sound with a vowel like bea for bear. Usually, vowelization stops by 6 years old too. Other patterns include affrication, where a non-affricate sound becomes like ch or j, for example, ko instead of shu, which typically resolves by 5 years. Alveolarization is when a non-alveolar sound turns into an t or d, like tum for thumb, and it usually resolves by 5 years. Depalatalization is when a palatal sound becomes a non-palatal one, like fit for fish, resolving by 5 years as well. Labialization involves replacing a non-labial sound with M or B, such as moof for mouth, and it generally resolves by 6 years. Coalescence is when two sounds combine into one, like foon for spoon, which also tends to resolve by 6 years. Reduplication or repeating a syllable like baba for bottle usually stops by age 3. Weak syllable deletion, where unstressed syllables are left out, like nana for banana, often resolves by 4 years. Epenthesis, adding an extra sound like nose for nose, typically resolves by 2.5 years. Assimilation, where one sound becomes more like another, like nan for nap, usually resolves by 3 years. If these patterns continue past the typical ages, it can make speech harder to understand. Speech-language pathologists check for these patterns and decide if therapy is needed. Therapy focuses on helping children replace these error patterns with correct speech sounds. This improves their clarity and confidence in talking. So, most phonological processes resolve naturally as children grow. But if they stick around past the expected age, it's a good idea to get a professional opinion. Early intervention can make a big difference in helping children communicate clearly and confidently.